Assalamu alaikum dear students. Today we will discuss very important topic is Haematology MCQs part 1b. Which anemia is caused by vitamin B12 deficiency? Option A, iron deficiency anemia. Option B, megaloblastic anemia. C, sickle cell anemia. And option D, aplastic anemia. So the correct option is B, megaloblastic anemia. Which leukemia is associated with the Philadelphia chromosome? Option A, CML, chronic myeloid leukemia. Option B, ALL. Option C, AML. And option D, CLL. So the correct option is A, CML. Subscribe now and press the bell icon. Never miss an update from Ali Technologist. Which condition shows cystocytes and low platelets? Option A, TTP. B, hemophilia. C, leukemia. And option D, polycythemia vera. So the correct option is A, TTP, thrombocytopenic purpura. Which marker is positive in CLL, chronic lymphocytic leukemia? Option A, CD19 and CD20. Option B, CD13. Option C, MPO, myeloperoxidase. And option D, CD34. So the correct option is A, CD19 and CD20. R rods are seen in option A, AML. B, CLL. Option C, multiple myeloma. And option D, Hodgkin lymphoma. So the correct option is A, AML, acute myeloid leukemia. What is the most common type of leukemia in children? Option A, ALL. B, AML. C, CML. And option D, CLL. So the correct option is A, ALL, acute lymphoblastic leukemia. Hodgkin's lymphoma is characterized by option A, red Sternberg cell. B, R rods. Option C, cystocytes. So the correct option is A, red Sternberg cell. Which condition shows smudge cells in peripheral smear? Option A, CLL. B, AML. C, ITP. And option D, hemophilia. So the correct option is A, CLL. What is the most common cause of neutrophilia? Option A, bacterial infection. B, viral infection. C, parasitic infection. And option D, autoimmune disease. So the correct option is A, bacterial infection. Which condition shows atypical lymphocytes in a blood smear? Option A, infectious mononucleosis. B, leukemia. Option C, thalassemia. And option D, hemophilia. So the correct option is A, infectious mononucleosis. Which stain is used for reticulocyte count? Option A, methylene blue. Option B, H and E stain, hematoxylin and eosin stain. Option C, Gram stain. And option D, Ziehl-Neelsen stain. So the correct option is A, methylene blue. What is the principle of ESR, erythrocyte sedimentation rate test? Option A, measures RBC settling rate in plasma. Option B, counts WBCs. Option C, detects hemoglobin variants. And option D, measures platelet aggregation. So the correct option is A, measure RBC settling rate in plasma. Which anticoagulants is used for ESR testing? Option A, sodium citrate, B, EDTA, C, heparin, and option D, fluoride. So the correct option is A, sodium citrate. What is the normal range for ESR in males? Option A, 0 to 15 mm per hour. Option B, 0 to 5 mm per hour. Option C, 10 to 20 mm per hour. So the correct option is A, 0 to 15 mm per hour. Which test is used to diagnose G6PD deficiency? Option A, fluorescent spot test. B, osmotic fragility test. C, Coombs test. And option D, D-dimer. So the correct option is A, fluorescent spot test. So what is the confirmatory test for DVT, deep vein thrombosis? Option A, D-dimer plus Doppler ultrasound. B, PT and APTT. C, bleeding time. And option D, CBC. So the correct option is A, D-dimer plus Doppler ultrasound. Which instrument is used for automated CBC analysis? Option A, hematology analyzer, for example Sysmex and Robi. Option B, microscope. C, centrifuge. And option D, ELISA reader. So the correct option is A, hematology analyzer, for example Sysmex and Robi. What is the purpose of a peripheral blood smear? Option A, assess RBC, WBC and platelet morphology. Option B, measure hemoglobin. Option C, test coagulation. And option D, detect DNA mutation. So the correct option is A, assess RBCs, WBC and platelet morphology. Which DHA regulation ensures lab quality standards? Option A, ISO 15189. Option B, FDA. Option C, CLIA. So the correct option is A, ISO 15189. What is the first step in case of lab spilling of biohazard material? Option A, contain the spill and wear PPE. Option B, run out of the lab. C, ignore it. And option D, cell security. So the correct option is A, contain the spill and wear PPE. Which anemia is caused by vitamin B12 deficiency? Option A, iron deficiency anemia. B, megaloblastic anemia. C, sickle cell anemia. And option D, aplastic anemia. So the correct option is B, megaloblastic anemia. Hence bodies are associated with option A, G6PD deficiency. B, thalassemia. C, autoimmune hemolytic anemia. And option D, aplastic anemia. So the correct option is A, G6PD deficiency. What is the most common cause of microcytic anemia? Option A, iron deficiency. B, vitamin B12 deficiency. C, folate deficiency. And option D, lead poisoning. So the correct option is A, iron deficiency. Thank you for watching my videos.